here we'll look at the phylum Spirochaetes, class Spirochaetae, and the family Spirochaetaceae, Borreliaceae, Leptospiraceae. Okay. The genera that we will be interested in are the Treponema, especially Treponema pallidum, causative agent for syphilis; Borrelia, causative agent for Lyme disease and relapsing fever; and also Leptospira interrogans, causative agent for leptospirosis. Okay, so in Malay Bahasa, this is also known as the penyakit air kencing tikus. The important species under this genera are listed here, and the diseases. You can differentiate them where Treponema pallidum are only found in humans and are not culturable. For Borrelia, mainly arthropod-borne, and for Leptospira, considered environmental bacteria. Spirochaetes is a phylum that is non-proteobacteria. They are gram-negative, motile, slender, and flexus. Morphologically, they are unique. So most of the time, they are viewed under dark field microscopy to give us presumptive identification. With Treponema, they are microaerophilic, and the type species is Treponema pallidum, which is the causative agent for syphilis. It is not true helical but has a flat waveform and restricted only to humans. They are extremely sensitive to environmental stress. So if anyone stated that they got the bacteria from toilet seats, then it is plain fabrication. The sexually transmitted disease caused syphilis is more serious than gonorrhea. So the initial infection for the Treponema pallidum is through broken skin. So tiny breaks in the epidermal layer, usually through sexual intercourse with an infected partner. So this will allow the bacteria to first multiply at the initial site of entry, causing primary lesion, chancre, for the first 2 weeks and sometimes lasting up to 2 months. So this is considered the first stage. So the chancre or lesion with yellowish pus will develop around the genital area. You should see the doctor immediately because treatment is by penicillin and it can be treated at this early stage. If you do not go to see the doctor, the chancre heals spontaneously. However, that doesn't mean the organism has disappeared. The organism only disappeared from the site and it has actually spread to other parts of the body. Spreading to the other parts of the body, that is the second stage of the disease where you will get secondary lesions. Lesions related to hypersensitive reaction where you get generalized skin rash on other parts of your body. At this stage, you are highly infectious, and if you still do not opt for treatment, half of the patients will enter tertiary stage and will progress to mild or fatal infections of the central nervous system. Dark field microscopy, you will see slight helical shape here. and treatment is easily available using penicillin. However, it works best at primary stage. And diagnosis is dark field microscopy of the exudates from the Chancre. Genus Borrelia is under the class Spirochaetaceae. It's microaerophilic, an animal or human pathogen. The type species is Borrelia recurrentis, which causes relapsing fever in humans and is transmitted via human body louse. So you have high fever, muscular pain of 3 to 7 days, followed by a recovery period of 7 to 9 days. And if untreated, there will be 2 to 3 cycles of this relapsing fever, and mortality is up to 40% for those infected if not treated. See the spirobacteria clearly. Treatment is via tetracycline, and there are other Borrelia that are of veterinary importance, causing disease in cattle, sheep, horses, and birds. But all of them are transmitted by ticks. Borrelia burgdorferi is the causative agent of a tick-borne disease called Lyme disease, which infects both humans and animals. So sometimes the patient's history is very important to give an idea of the possible agent that is causing the problem. It has gone to the farms. It's possible that they were bitten by ticks from the animals, and that will bring about diseases caused by Borrelia. Leptospira is an aerobic spirochetes. There are some that are free-living and considered environmental, and they are in the class Leptospiraceae. Leptospira interrogans is the type species and is parasitic for both human and animals, with rodents as natural hosts. So campsites, waterfalls that are not clean and have rats, there is a possibility that these rats will carry the bacteria, and when the rats urinate onto the water, the bacteria will actually survive in the water environment. So when looking for waterfalls or rivers for picnic, it is best to go for rivers that are flowing and healthy, not stagnant waters that are potentially reservoir for Leptospira. So in humans, leptospirosis occurs when the Leptospira localizes in kidney and can cause renal failure and death. So here you can see the spiral shape of the bacteria. There are over 200 serotypes. They are best observed by dark field microscopy, and they occupy a diverse range of environments from high humidity and neutral pH. They are gram-negative with 2 polar flagella, and occupations at risk for leptospirosis are farm workers or those working around contaminated water. Leptospirosis is most common in tropics, also known as Wales syndrome. It affects both humans and other animals, usually rats, cause an enlargement of the spleen, jaundice, and nephritis, and it is the most common zoonotic disease. So it is transmitted by consuming or in contact with contaminated food or water, usually contaminated by animal urine. So human to human spread is still not known, and it takes about 4 to 14 days incubation period. So in the first stage, it will be flu-like with fever, chills, headaches, and muscle pains. Then it will enter second phase where you have pneumonia, high fever, severe hot headaches, chills, vomiting, jaundice. Then if the disease progresses, further complications will include renal and liver failure. Most of the time, they will only get the mild form of the illness. However, among elderly or immunocompromised, usually those with liver disease or kidney disease, the mortality rate can be up to 40%. So in the first 7 to 10 days, serological testing and blood samples will be adequate. Then after that, isolation from fresh urine. Culture is on Ellinghausen, Aculev, Johnson, Harris media at 30 degrees Celsius for 2 to 7 days. However, this is more for research. You're able to have presumptive identification from the dark field microscopy of the urine itself. So medical history is important, whether there is any contact with stagnant water or water aquatic habitats. And the treatment is 100 milligram doxycycline orally every 12 hours for 1 week. So these are the risk factors, especially those related to the environment when you and those that expose you to aquatic habitats. So Leptospira can be in the animals itself, mammals, especially rats, and the Leptospira in the urine can contaminate water, mud, and soil, which can then enter wild mammals as a reservoir before going back to free living. So this is the zoonotic cycle of a Leptospira.